There are many different types of kidney diseases, including acute kidney injury, AKI. This is a sudden and temporary loss of kidney function that can occur due to a variety of reasons such as dehydration, blood loss, infections, or certain medications. Chronic kidney disease, CKD. This is a long-term condition in which the kidneys gradually lose function over time, typically over a period of years. CKD can be caused by a number of factors, such as diabetes, hypertension, and other health conditions. Glomerulonephritis. This refers to a group of diseases that damage the glomeruli, the tiny blood vessels in the kidneys that filter waste from the blood. This can cause protein and blood to leak into the urine. Polycystic kidney disease, PKD. This is an inherited condition that causes numerous cysts to grow in the kidneys, leading to eventual kidney failure. Nephrotic syndrome. This is a condition that occurs when the kidneys excrete too much protein into the urine, leading to swelling and other symptoms. Pyelonephritis. This is a type of kidney infection that can occur when bacteria from the bladder travel up to the kidneys. Kidney stones. These are hard, stone-like deposits that form in the kidneys and can cause pain and discomfort. Kidney cancer. This is a type of cancer that can develop in the kidneys, usually in adults over the age of 40. These are just some of the many types of kidney diseases. It is important to see a doctor if you experience any symptoms such as swelling, fatigue, or changes in urination. What are the causes for kidney diseases? There are many different causes of kidney disease, including diabetes. High blood sugar levels can damage the small blood vessels in the kidneys over time. High blood pressure. High blood pressure can damage the blood vessels in the kidneys, reducing their ability to filter waste from the blood. Glomerulonephritis. This is a group of diseases that damage the glomeruli, the tiny blood vessels in the kidneys that filter waste from the blood. Polycystic kidney disease, PKD. This is an inherited condition that causes numerous cysts to grow in the kidneys, leading to eventual kidney failure. Urinary tract infections, UTIs. UTIs can spread to the kidneys and cause damage over time. Kidney stones. These hard, stone-like deposits can cause damage to the kidneys over time. Prolonged use of certain medications. Overuse or misuse of certain medications such as painkillers, antibiotics, or some herbal supplements can lead to kidney damage. Autoimmune diseases. Some autoimmune diseases such as lupus can cause inflammation in the kidneys leading to damage over time. Congenital abnormalities. Some individuals are born with abnormal kidneys that can lead to kidney disease over time. These are just some of the many causes of kidney disease. It is important to speak with a doctor if you have any concerns about your kidney health or experience any symptoms such as changes in urination, swelling, or fatigue. What are the causes for kidney stones? Kidney stones are hard, stone-like deposits that form in the kidneys. The exact cause of kidney stones is not always clear, but some factors that can contribute to their development include dehydration. Not drinking enough water can cause the urine to become concentrated, which can lead to the formation of crystals that eventually develop into kidney stones. Diet. A diet high in salt, animal protein, and oxalate-rich foods such as spinach, chocolate, and nuts can increase the risk of developing kidney stones. Genetics. Family history of kidney stones can increase the likelihood of developing them. Medical conditions. Certain medical conditions such as gout, inflammatory bowel disease, and hyperparathyroidism can increase the risk of developing kidney stones. Medications. Certain medications such as diuretics and calcium-based antacids can increase the risk of developing kidney stones. Urinary tract infections, UTIs. UTIs can create an environment that promotes the formation of kidney stones. Obesity. Obesity can increase the risk of developing kidney stones. These are just some of the factors that can contribute to the development of kidney stones. If you have a history of kidney stones or are experiencing symptoms such as pain or changes in urination, it is important to speak with a doctor for further evaluation and treatment. Certainly, here are some additional causes of kidney stones. Hyperoxaluria, a medical condition in which there is an excess of oxalate in the urine, which can combine with calcium to form kidney stones. Cystinuria, an inherited disorder that causes high levels of cysteine, an amino acid, to be excreted in the urine, which can lead to the formation of kidney stones. Hypercalciuria, a condition in which there is an excessive amount of calcium in the urine, which can combine with other substances to form kidney stones. What is creatinine test? Creatinine is a waste product produced by the muscles that is filtered out of the blood by the kidneys. A creatinine test measures the amount of creatinine in the blood and is a common test used to assess kidney function. The creatinine test is a blood test that measures the level of creatinine in the blood. The test is used to evaluate how well the kidneys are functioning by measuring how efficiently they are able to remove creatinine from the blood. High levels of creatinine in the blood can indicate decreased kidney function, while low levels may indicate overhydration or other medical conditions. The creatinine test is often used in combination with other tests such as a urinalysis or GFR to evaluate kidney health. It is a simple and commonly performed test that requires a small blood sample. The results of the test can help healthcare providers diagnose and monitor kidney disease and guide treatment decisions. How does the creatinine test conducted? What are the ideal range creatinine levels in the blood for kidney functioning? The creatinine test is a simple blood test that can be performed in a healthcare provider's office or laboratory. Here are the general steps for conducting a creatinine test. The results are typically reported in milligrams per deciliter, milligram per deciliter, or micromoles per liter, micromole per liter of blood. The ideal range for creatinine levels in the blood can vary depending on a person's age, sex, and muscle mass. In general, a normal range for creatinine in the blood is approximately 0.6 to 1.2 mg per deciliter, 53 to 106 micromoles, L, for adult men and 0.5 to 1.1 mg per deciliter, 44 to 97 micromoles, L, for adult women. However, it is important to note that creatinine levels alone do not determine kidney function. The creatinine level can be affected by factors such as age, sex, muscle mass, and certain medications.